Good morning, everyone. My name is Tavon McDonald, your average Bronx citizen currently living upstate, and I present to you how the COVID-19 pandemic has affected aspects of our daily lives. I and the rest of Group A of the 2020 Summer Youth Employment Program will discuss how we've been affected physically, mentally, and socially by this historical event.
Hi, my name is Paulina Martinez, and my group did mental health virtual learning. Coronavirus during this time has affected us by creating more stress and fear of either passing the disease and fear of losing scholarships and funding. Here are some questions that students have asked themselves during this quarantine. One important question is, how has your ability to learn changed over the time of this pandemic? Student learning has impacted due to students either being easier to learn online or either harder due to the amount of assignments and distractions. There are many obstacles faced during the pandemic for students, such as trying to stay on schedule with classes or being overwhelmed by the workload. Some tips are to practice time management, which is a very big one, eliminate distractions, and creating a regular schedule to stay organized.
Up next is social behaviors. So mental illnesses have a wide range of symptoms and conditions, along with complications including extreme mood swings, excessive tiredness, low energy, excessive anger, violence, hostility, social isolation, family conflicts, substance abuse, and self-harm. At the beginning of pandemic, schools, universities, businesses, and offices closed down. This meant that a lot of people who were used to getting up and going out for work and school had to stay inside for weeks and months on hand. This is the first time that New York has ever shut down in general, which led to children in schools losing their abilities to see their friends, grow their social skills, and being able to openly learn in a supportive environment. And people can no longer openly play, hang out, and be close with their friends. According to a Times Magazine article, there are about 36 million people in America who live alone. And even though there are people who live with roommates and their families, they still felt lonely as well. Based on a survey completed by 1,228 people, over 2/3 and more of the age groups felt lonelier due to the pandemic. Long periods of time experiencing loneliness and social isolation can cause a decline in one's mental health and overall livelihood, which are linked to depression, emotional distress, smoking, poor sleep schedule, high blood pressure, suicide, and more. So how do you continue to be social during quarantine? Obviously, be safe, wear your masks, and wash your hands frequently. Stay in touch with your friends and family through FaceTime and phone calls. You can also play games with multiple people and sign up for online programs. In conclusion, COVID-19 has triggered a large-scale shift in behavior that imposes a lot of stress on individuals due to social distancing and not being around people anymore, which led to a detour in their mental health. And the most effective ways to staying in touch with your friends and family and making sure you're social is through calling and using your phone and staying up to date with online classes and programs. And some questions to ask your students: what are your thoughts on schools reopening in the fall? How are you able to maintain a stable mentality socially? And how has COVID-19 affected any relationships with your friends and families or strain on your mental health?
It's Tavon again, and I'm going to be going over the physical aspect of the COVID-19 pandemic. The pandemic made exercise way more difficult than it normally is. Gyms are closed, group meetings for exercise are not recommended, and people are overall feeling less motivated to work out because they're losing all the progress they've made over the years in the gym. And also, they're developing eating disorders while stuck indoors. Doctors recommend at least 30 minutes of moderate exercise or 15 minutes of intense exercise each day. There are many benefits of exercise, particularly weight loss, which is the biggest interest for most people. Um, Next, exercise can affect the youth's mental health by increasing our mood and developing our bodies in this prime time, which is from 16 to 21 years old, which can guide us later on in life when we're not as physically able. Exercise habits are less common now as people are feeling less motivated to work out. Like I said earlier, gyms are closed and people are only resorting to home workouts, which are overall less enjoyable. One example of a home exercise anyone can do is push-ups. Push-ups target the shoulders, chest, and triceps area, which are the development of the upper body. There are many variations of push-ups you can do, which can target specific muscle groups, and you can even target your core with a specific variation. Outdoor spaces such as parks can be used for physical exercise too, should a bench or pull-up bar be available. Just be sure after you're done using these to wipe them off to stop the spread of the pandemic. There are also a lot of apps you can use to guide you if you're not sure about what to do regarding physical fitness. These I would recommend highly because they're not anywhere near as expensive as personal trainers and you can use them anytime, anywhere. Here are some questions you can ask yourself regarding physical fitness during these trying times.
The next topic is social health, activism, and justice among youth in the pandemic. What is activism? Activism is the policy or action of using vigorous campaigning to bring about political change. How has the pandemic affected activism? The pandemic has affected teenagers' participation in activism because many teens have had heavy social media presence and an increase in learning about current issues. Activism on social media. There have been the use of hashtags and infographics as a way to send information across social media platforms. What is social health? Social health is the ability to form relationships with others, such as coming together as a community for social and political change. An example of this would be the Black Lives Matter movement and the protests occurring after George Floyd's death. Protests in a pandemic. It is a good thing to protest, but at the same time, many people are not wearing masks. It is important that we wear masks and be mindful of all of the consequences from COVID. Political conflicts as protests. During the pandemic, people should be practicing social distancing, which is 6 feet apart, and should have their face mask on the whole time. Conclusion. Overall, social health and activism and justice is affected severely by the pandemic. People already risk their lives when they protest due to police brutality, and now we have to keep social distancing in mind. Self-reflecting questions for teens. The most important one is, how can you currently as a teen practice activism?
Mental health and youth disability justice. The meaning of disability justice is a framework that shows disability, ableism, as it relates to many other forms of oppression and their identity, for example, like race and size. Since COVID-19, there's been more injustice happening with the youth with disabilities, from ventilators not being given to them in some hospitals to denial of treatment for them as well. What needs to change now? Since this is just the first wave happening in America, for the second wave, they should be more prepared for these people with the disabilities. From this will be, from this, there will be more doctors and nurses to focus on those who need it the most, like this people with disabilities, and extra help with this will help extra help during this crisis. Having more doctors available for them will help the situation, even if hospitals themselves needs to hire more.